Hi, Dr. Eric Thomas for Nutmeg Dermatology. I thought we'd talk today about skin exams. Why they're useful, I think that's obvious, I hope it is, and what you should expect when one is performed. Why is it important? Well, if you look at the number of cancers in the United States of all types, lung, breast, colon, and so forth, the most common is a non-melanoma skin cancer called a basal cell carcinoma. So many that they're not even officially registered, but we know there are 1 million or more. Then after that, squamous cell carcinoma, very common also, sort of a cancer of the same cell type in the skin. It's called a keratinocyte. But squamous cell carcinomas are a little bit more aggressive and can spread internally. Both of these, however, tend to show up in sun-exposed areas. They can go elsewhere. And as a result, they often are on really expensive real estate. By that I mean your nose, ears, forehead, face, of course shoulders, back also. Then down the list after lung cancer, breast cancer, colon cancer, bladder cancer is, not too far down the list, is melanoma. So of the top X number of cancers, 3 of them are skin cancers. And unlike certain examinations, which people do and should do, let's take, for example, a colonoscopy. I don't know if you ever had one, but the prep for a colonoscopy, takes a day. It's pretty uncomfortable and well worth doing. But what are they doing? They're just looking. It's hard to look in the colon. What are we doing? We're looking. What's the difference? It's easy to look at the skin. It takes a few minutes to disrobe to the extent that you're comfortable. Some people leave on undies, and that's just fine. We always offer to do a thorough exam, though, because it is important. Melanomas, as we may have mentioned, as we did mention in a prior show, can show up where the sun doesn't shine. Soles of feet, toe webs, scalp. And these areas really have to be looked at, or you're going to kill someone, actually. So enlist your near and dear. Keep an eye on areas they can't easily see, such as their back. If you're by yourself, then it's even more important to come in to be looked at. So we do use certain instruments which are worth talking about. There is a simple handheld instrument called a dermatoscope, which has very bright lights that are able to penetrate just far enough below the surface of the skin. They don't bounce back, they're at a certain angle, and we can see the pattern that the pigment makes. We can see if there are tears. It's like a fisherman's net. We can see if there are clumps. We can see also if there are blood vessels, and sometimes we look at a bluish, blackish spot and reassure people, oh, that doesn't need to be done. It's blood vessels and they're very rarely, etc., etc. And that's another thing that's important. Anyone can just say, hey, it's suspicious, let's take it off. You don't want that. I mean, you want it if it's really clinically suspicious. You want to watch it, but you also want someone with the confidence and the experience to say, look, it looks okay to me on a clinical basis, 99.99% you can watch it. If you want 100%, and that's your right, then we will cut it out. But if you wish to watch it, maybe you'll save yourself some unnecessary surgery. That's not such a bad thing to do. So anyway, we're thinking of you. We treat you the way we would want to be treated. Here's looking at you. Let's hope we all have as good health and quality of life for as long as we can. Eric Thomas for Nutmeg Dermatology.